Hi everyone, today for Wednesday Wisdom we are going to be looking at the main gynaecological conditions that we see with clients in clinic. So I want to talk about the three main ones. Obviously there's a huge variety of different conditions that are impacting women, but I want to go through the three main ones to flag it up in your mind. So if you are suffering with any of these symptoms or you're experiencing any of the pain or any of the complications from it, you know what you need to do, you can identify it and go and see the relevant people. So number one, endometriosis. So endometriosis is a condition where cells of the endometrial tissue, the lining of the uterus, come apart and can form in other areas of the body. So you find with endometriosis very typically outside and within the uterus. It can go into the fallopian tubes and the ovaries. 20 to 25% of people with this can be asymptomatic, but what we can find with endometriosis is it can cause quite severe pressure and pain around the pelvis. Depending on where the endometrial cells have moved to and where they're congregating, it can either find that you get back pain or pain pulling down into the legs, so you can get quite widespread pain around the area. Due to the fact that it's the endometrial cells of the uterus, it typically flags up around the time that we're coming on our periods. So either 2 to 3 days before menstruation or during our period, that is when the pain is at its peak. And this is where it can be so sore and can feel like that pressure build up in the tummy. Most common complications for this are family history. So if your mother, sister, anyone in the family that have it, that makes it more common to have it. There is genetic factors, and so what they would look at for this is how you respond to treatment. They would probably do an ultrasound and a pelvic exam at the doctor. They would see how you respond to treatment. So if it's severe enough, what they would do is actually remove the tissue, but most of the time it can be controlled by the combined contraceptive pills. They look at birth control and maintaining and controlling your hormone levels, and that can help with endometriosis. Secondly, we're looking at is Pcos, so polycystic ovarian syndrome. And these are a set of symptoms that are formed when someone has elevated androgen levels, so male hormones in the body. So cysts forming around the ovaries. This can give irregular periods. It can either give amenorrhea or oligomenorrhea, which means you have fewer periods or no periods, or it can even have it where you have none for ages and then you have a very heavy period due to the hormonal changes. What we find with PCOS, which can be really quite debilitating for people, is obviously it can give pain around the pelvis, but you typically have symptoms of increased androgen levels. So weight gain around the tummy, we can get hair growth, we can get acne, and what they've also linked it to is higher levels of obesity and type 2 diabetes. So you can have that in related to other conditions. It can also lead on to a higher risk of like we said, type 2 diabetes, but also infertility. So if you're suffering with PCOS, or you're noticing changes in your periods, or weight gain or hair growth or acne that's got really bad, or weight gain around the tummy, what I would always recommend is going and popping and seeing a nurse or a doctor and getting it assessed properly. So getting them to look to see if you can control those hormonal levels, or if you need to take metformin to look at the change in the insulin levels and also the risk for the diabetes. Number three, the third thing we're going to be looking at is fibroids. So fibroids are benign cellular tissue. So it's the smooth muscle tissue that forms a tumor, a benign tumor, typically within the uterus, but can form around the area. So can be very sporadic, most commonly within the uterine wall. What this can be is asymptomatic, but the problems occur when they start to cause pressure and pain in the pelvic region for women. So fibroids are typically left untreated if they're asymptomatic and they're not causing any obstruction. However, the size of the fibroid can increase, and if you are suffering pain, referral and pressure into the back and the tummy. But what you can also find is it can start to press on the bladder, so you can get bowel and bladder changes as well. What you can also get is quite abnormal or excessive bleeding with the fibroids, so it can make people feel quite anemic. So you can get signs of anemia, so shortness of breath, palpitation, fatigue. And so the reason why I'm telling you about all these different conditions is if you have it in your past history, or if you're coming in with it, or you're suspecting any of these symptoms or changes in your menstrual cycle or pain around the pelvis, obviously we would screen for this in a systemic screen, but it's worth going and seeing a doctor, going and popping in and seeing a nurse, getting them to assess your symptoms and find out if there's anything they can do to help. So what they would look at with the fibroids, if it's not obstructing, they would give you meds to control the pain and reduce the pain. Any medication that can reduce the size of the fibroids. What we typically find post-menopausal is when we get that drop in estrogen, the fibroids tend to shrink anyway. But if you're still kind of at that age before the menopause and you're having quite severe fibroid pain or the enlargement of the fibroids, what they would look at is actually removing the fibroids for you. So we've looked at endometriosis, we looked at Pcos, we looked at fibroids. Any question, let me know. The reason why we're covering this is that, one, we screen for it in our consultations, but also want you to be hyper aware that if you are getting these changes as a female, it's definitely worth chatting to someone about it, getting it assessed properly, and finding the perfect treatment for you. But hopefully this has been helpful for Wednesday Wisdom. We will catch up next time. Any questions, please comment below, and look forward to the next topic next time.